Hi, this is Dr. David Greene, CEO of the Arizona Pain Network. Today's topic are the top 5 ways to avoid low back surgery due to degenerative disc disease. Now, degenerative disc disease, known as DDD for short, affects millions of Americans, usually between the ages of the mid-20s upwards of about 60. Okay? Now, it's a big problem in the U.S., and one is because we really don't have or haven't had great non-operative methods up until about the last 15 years or so. There was like this huge gap between just, medications and surgery. All right? So we're going to talk about the other ones in between that can be very effective. The first option, ironically, is medication. There are plenty of non-narcotic medications available, such as anti-inflammatories, which are available over the counter, like ibuprofen, naproxen, and then for higher doses, you can get a prescription for them, along with Tylenol. That can be taken at the same time. All right, just make sure to take them according to the manufacturer's recommendation. Another medication that can be considered is a non-narcotic called Ultram, or Tramadol is the generic. And that really is a non-addictive medication, which is stronger than the anti-inflammatories, but can also be very effective. For short-term exacerbations, narcotics can be given, but they're just not a good idea to take them on a chronic basis because of the potential complications with addiction, intolerance, overdose possibilities, along with constipation. It's just not the best idea. All right. So moving into number 2, the best option is physical therapy. Physical therapy can be extremely helpful for strengthening one's core and taking pressure off the low back, okay, along with chiropractic manipulations, ultrasound, electrical stimulation. A TENS unit can be very helpful. A TENS unit can help change the way that your brain perceives pain signals. All right, so I put all those into number 2. Number 3, I want to talk about traditional interventional procedures. Now, in addition to having a degenerative disc, they're often, because of the abnormal biomechanics of that disc, stresses get shifted to the back of the spine, and you can get arthritis in the thumbnail-sized joints called the facet joints. Okay? Now, treating that, you can have facet joint injections, also injections around the facet joint called medial branch blocks, and either of those can provide pain relief on average between 8 and 12 weeks. All right, so depending on how much pain is coming from the disc versus how much pain is coming from those joints, it can be very effective. So if you go on to have good success with a medial branch block or facet injection, then another procedure is called a radiofrequency ablation. Now that is not in the disc, but basically what that does is it heats up these tiny little sensory nerve endings around those joints, and it can give pain relief for, on average, 15 months is what the studies show. When you're talking about an injection into the disc, that we're going to talk about number 4 now, there are injections of steroid, and there have been studies showing that steroid injections into the disc can give very good pain relief. All right, but the newest regenerative medicine injections into the disc are platelet-rich plasma therapy and stem cell injections. So these have the capability of actually repairing and regenerating the damaged disc. Okay? So platelet-rich plasma therapy is very simple. It's just a simple blood draw from your arm. That blood gets put into a kit, and it's spun around in a machine called a centrifuge for about 15 minutes. And then part of that blood is then injected into your disc, and it has growth factors, it has cytokines, it has concentrated platelets, hence the name platelet-rich plasma therapy. But there have been some studies out very recently that show excellent results for pain relief and increase in function. So that should be considered. Another option is stem cell therapy, and that is either from your adipose tissue, your fat, bone marrow, or there's also amniotic stem cell therapy. And all of those in small studies have been shown to be excellent for pain relief and increases in function. Now, the 5th way to avoid the need for low back surgery is epidural steroid injections. Now, most people think that epidural steroid injections are only for sciatica when a nerve root is being pinched. Normally that's the case. But when you have degenerative disc disease and it's causing pain, and a lot of degenerative disc disease does not cause pain, okay? So keep that in mind. Just because you see degenerative disc disease on an MRI doesn't mean that you're going to have a life of pain. Most people don't even know it. All right? But anyway, back to number 5. The reason that an epidural steroid injection can help if you have symptomatic degenerative disc disease with low back pain is because when you have degenerative disc, the outer rim of the disc can get inflamed, and it can cause inflammation of the adjacent nerve root. So here's the disc, here's the nerve root, and that inflammation can start to spark up inflammation in the nerve. So delivering an epidural steroid injection can give some relief of the outer area that's inflamed and the area around the nerve root. So it can be very effective for the pain emanating from a degenerative disc. All right. So all in all, with that combination, over 90% of individuals who have symptomatic degenerative disc disease can avoid the need for surgery. Because surgery for degenerative disc disease is almost like a roll of the dice. Half of patients get a lot better, and half of patients really don't get better. And then you've had surgery, and even the ones who do get better, we know that lumbar spine surgery has a 40% failure rate after 2 years. So it's not the greatest option that we have. We thought artificial disc replacement was going to be the greatest thing since sliced bread when it came to low back pain. It hasn't produced better results than a simple fusion. All right, visit us at ArizonaPainNetwork.com. There's a lot of educational information and videos on the site. You can see the locations of our centers, the doctors who we... So visit us at ArizonaPainNetwork.com. You can see a lot of educational information, the locations of our treatment centers, a bit of bio on the doctors, the insurances that we accept, and the phone number to call for scheduling. Thank you very much.